heart health. If you're not thinking about it, I hope after this episode you start to. Hey everyone, I'm Tracy Steen of Move Daily Talks. I'm your host today, and we're welcoming back Michelle Routhenstein. She's a heart healthy dietitian. She was so insightful last time she was on. I just had to have her back. And there's no better time to start talking about heart health than right around the holidays. January's around the corner. And I don't know about you, but it is something that is on my mind. I want to do everything that I can to stave off heart disease. And some of the tips Michelle gave today are so great. Something that you can do every single day to monitor where your heart is at. And I'm definitely doing that one. Michelle is the owner and president of Entirely Nourished. It's a virtual nutrition counseling and consulting practice. She's already helped thousands of people address the underlying root cause of heart disease that has led them to lower their blood pressure and cholesterol levels, put AFib into remission, improve heart function and heart failure, reverse fatty liver disease and gout, reduce insulin resistance and blood sugar levels, and reduce risk of heart attack and stroke. Sign me up. I want to reduce all of those things. I'm so happy to have Michelle Routhenstein back. Let's welcome her to the podcast. So holiday food is abundant. It's around everywhere right now. A lot of us are indulging, and why not? It's the time of the year. However, what I find, and I'm not sure if you're the same, but January is going to be super busy for me because I think often what happens is people can tend to throw the baby out with the bathwater. And so maybe holiday partying and indulgence start, you know, at Halloween and continue right up until January. And I think what happens during that time, if we're not really cognizant and we're not really paying attention, is that we get into a pattern, right? We get into this habit. And then we also get a good hit of dopamine every time we do indulge. And so when we try to stop, when we try to shift, it's challenging. I know you're going to be busy in January as well. So how do we, there's maybe only a few weeks left of December, but how are we going to make that transition into healthier eating in the new year?
I think you kind of hit it right off from the start. We go into this all or nothing mindset. And that puts us into this place where we can't sustain behavior changes. And we often are in the process rude to ourselves and how we speak, right? It's like, oh my God, look at what you did in December. We have to be really good in January. And this is a lifestyle effect. So we need to be looking at this from the point of view of this, holiday season is going to come again. And we need to be looking at a lifestyle that really takes all of this into account. And it's funny you mentioned January. We get these New Year's resolutions. We want to change all of our behaviors. We want to lose weight. We want to do this. We want to do that. And I had someone reach out to me the other day being like, if you could tell people the number one New Year's resolution that they should be focused on, what would you say? And I gave it a second of a thought. And I'd be like, if I had to just pick one thing, it would be to avoid that, like, I need to go on a crash diet. I need to do it
Amen.
to lose weight. And I went and I said, check your blood pressure.
Hmm.
And I said, check your blood pressure at home because you don't need to go to a doctor's office. You don't need blood work. You can tell the effects of how hard your heart is working right when you wake up in the morning. And that gives us so much information about your cardiovascular health that's silently happening that we don't take cognition of because we feel fine, or that's what we're used to being, how we feel in the morning. So I bring this up because I want 2025 to be a year where we're really smart about our health. There's going to be new fad diets. There's going to be new, biohack, do this, do that for your health. We're seeing that so much in 2024. It's going to get much worse in 2025. So I want people to really hone in to how do I actually assess good health and well-being? And the best thing you can do is check your blood pressure in the morning to make sure it's optimal. We've moved those markers. Now we really want them 110 over 70. We used to say 120 over 80. We used to say, oh, 130 over 80, let's just monitor it. Doctors will only prescribe medication at 140 over 90. And now
Right.
that line is now actually less, but this is really important to mention because if you are walking around with that level that you don't know, it can cause plaque to form in your arteries. It can cause heart failure. It can cause cognitive decline. And those things don't show up until it's been high for a long period of time. So let's take action. Let's know the number, optimize it. That's so powerful from a health perspective, and especially a heart health perspective in the new year.
Yeah, knowing your numbers. I totally agree. I think for so long, we were just in the dark. We just didn't, we would go to the doctor. They would take our blood pressure. We wouldn't ask. They would say, it's good. And we didn't know. And I remember asking my mom, what's your blood pressure? She's like, I don't know, but they say it's good. I'm like, well, mom, we got to know our numbers. And so I definitely would started asking. I have a blood pressure cuff at home, and I test periodically, maybe not every day, but when you're looking for a blood pressure cuff, I mean, we could ask Santa for one of these under the tree, I suppose. Is Costco a good place just to buy a basic one? And is it better to have an automatic one, or should we be looking to get the, manual stethoscope whole thing? We don't need that, do we?
No, no, no.
Yeah.
So you don't need a frilly blood pressure cuff. Honestly, there's a big brand that you can get in any local pharmacy, CVS, Walgreens, called Omron.
Omron. Yeah,
Get the
that's what I
basic
have.
series. You don't need a necessary, you can get it Bluetooth where it syncs to your app so you can track it and have that data. But you don't need any like very fancy blood pressure monitor. If you realize though that your blood pressure monitor may be old and you're not sure if it's accurate, you can bring it to one of these pharmacies and check theirs with yours and see if the number is right. Or you can, next time you go to the doctor's office, make sure that it's calibrated so it's the same number on your machine as their machine too. But especially when you just mentioned like your mom doesn't know her blood pressure, that's really important to recognize because we talk about these ranges. But for instance, I run very low blood pressure. So my blood pressure being 90 over 60 is my normal. So if
Yeah.
I go somewhere, I'm checking it and now it's 120 over 80, no one's going to tell me it's high, but that's high for me. And so if we don't know our own baseline, that means that we're not taking actual care because if I'm running 120 over 80, that something may be going on in my body that's not what usually happens. And so we don't know our baselines, then we're going on arbitrary numbers that aren't really actually helping us. So we need to know our baseline so we know, oh, wow, that's high for me. And so we can take proactive action.
So what causes our blood pressure to rise?
Great question. So there are many, it's multifactorial. If you go to the traditional model, you have high blood pressure, the doctor will say two things to you. Either, oh, are you anxious or nervous in the doctor's office? Maybe it's white coat syndrome. Right? And then the other one they'll say is, hey, follow a low sodium diet. I want to talk about both of those things and
Mhm.
then add a lot more value to it. So, for instance, when you go to the doctor's office and you have high blood pressure, oftentimes people will say, oh, it's just anxiety, don't worry about it. And then you see them in a year. And a whole year goes by. And when we look at the research, people who have white coat syndrome have a much higher risk of having actual true hypertension and having cardiovascular issues. So
Okay.
don't chalk off white coat syndrome as, oh, yeah, I'm nervous. I'm in a doctor's office. Who isn't nervous in a doctor's office? I want you, especially if you have white coat syndrome, especially, I want you to be checking your blood pressure at home
Mhm.
because you need to determine is it anxiety or is it actual true hypertension? Some people are anxious by checking their blood pressure, right? They see a blood pressure monitor, they get nervous.
Yeah, it gets tight. You're feeling constricted. Yeah, so that can go on, right?
Yeah, but also it's the fact like if it's high, what am I going to do? Am I having a heart attack? Do I need to go to the hospital? Like these are what if situations that are valid and very true to many people. But I want you to look at it differently. I want you to take an empowered approach and saying, "Hey, if it's high, what am I going to do to bring it down? What's causing it to be high?" When you
Mhm.
have an empowered action plan, you become friends with your blood pressure cuff. I have clients who say to me, "Michelle, in my whole entire life I had white coat syndrome. After I implemented everything, blood pressure was 170 in the doctor's office. I can't believe that's actually true. And so I think white coat syndrome needs to be really actually looked at as a potential risk factor for hypertension because
Mhm.
it is. and
Yeah.
we need to be more actual honest about it and check it at home. So anxiety does play a role, right? You're nervous, your arteries will constrict because you're in a fight or flight state of mind. So yes, anxiety can play a role, but it's usually there's many other factors that will have a higher propensity to increase it.
So what does an empowered action plan look like if we do have high blood pressure? What could that look like for us?
So we need to understand, why did it go up, right?
Right.
So it could be multifactorial. One is sleep, right? So if you have uncontrolled sleep apnea, and that can be a cause for high blood pressure in the morning because you are having oxidative stress. Your body's not getting oxygenated blood during the evening. And so that can cause constriction and lead to higher blood pressure in the morning time period. We know nutrition from many aspects can also do it. So, for instance, I talked about sodium. Most doctors will say, hey, follow low sodium diet if you have high blood pressure. And there is truth to that.
Hmm.
Excess salt causes constriction in the arteries, which can also increase blood pressure. But sodium alone doesn't really have as much of an impact on controlling blood pressure as what else we're eating with it. So in the research, we see that our sodium to potassium ratio matters more than either one of those nutrients by themselves, because sodium constricts the arteries, but potassium vasodilates. It opens up the arteries. And especially when paired together, if you have too much sodium in that meal, it signals your kidneys to flush it out. So that way you're not having that hypertensive effect from sodium alone. So it could be, did you have a very high salt meal? Did you eat out dinner the night before? Did it not have enough potassium? That could be looked at too. With blood pressure and with every metabolic condition, they are never in silos. Blood pressure
Hmm.
does not work by itself. Think about what high blood pressure is. It's your heart having to work harder to pump blood throughout the body. Actually, one big thing that causes blood pressure that most people never talk about is insulin resistance. Insulin resistance actually causes a feedback loop in your kidneys to retain sodium, and that can increase blood pressure. So you have to be looking at, what's the cause of it? Is it insulin resistance? Is it nutrient deficiencies? Is it sleep? Is it inflammation? Is it dehydration? Is it overhydration? Is it a combination? And so blood pressure there's a lot of different factors. And this comes to say also that some people will be resistant hypertension, which means the doctor, when someone has high blood pressure, the doctor will throw one medication at you. If that medication doesn't lower blood pressure, they throw another. If that one doesn't, they throw another. So all three of those medications help to address different pathways in which raise blood pressure. But if you're not addressing what's the cause, blood pressure will remain high. So many times people have cut back on sodium, but that's not the full picture of why
Yeah.
it's elevated.
It is tricky. My son has high blood pressure, which is so odd. He did never presented with any symptoms. I think a lot of people who have high blood pressure get that sort of pulsating in their hands or behind their eyes, or um, different feelings that things feel like pressure. He didn't have any of that. In fact, he went into the doctors because he had hurt his foot. I went into the hospital to get an x-ray, and they took his blood pressure, and it was really high, like 200 over 150. And they're like, oh, you have high blood pressure. And he's like, I didn't even know. And so they're like, well, maybe it's the cuff. Let's try the other side, because he's pretty muscular. No, other side the same. And they're like, okay, you got to go see your doctor. Doctor takes his blood pressure, and it's super high again. And so, a series of tests like EKGs and heart scans, and I mean, he went through the whole thing, and they still couldn't find anything. So, I mean, even the cardiologist couldn't find anything. And so then he's on this medication, of course, to bring it down. But that's concerning. Sometimes blood pressure, like, what is the cause? So the doctors have been researching and trying to find, and at this point, they still don't have a cause. And so have what can be done with that? He's fit, he's lean, and what do you do when you don't really know? I guess you just stay on the statin then, because that's going to save your life, as opposed to just having really high blood pressure. But thoughts on that?
So, good questions. A lot of times when you're looking at causes, they don't necessarily show up on certain echocardiograms or heart scans if they're not looked at from a preventative viewpoint. So, for instance, even someone who is lean can still have high blood pressure. Body
Mm.
size does not indicate, oh, if I lose weight, I'll lower my blood pressure. Well, it depends what you're eating. So oftentimes, when we're looking at the cause, it's really looking at factors that we can test by blood work, but also through diet. So some people have uncontrolled sleep apnea. Was that tested? Some people have nutrient deficiencies. Many people may also be, depending on their exercise regimen, be overstressing their heart. Sometimes there is genetic components, so we
Mhm.
want to rule out for cardiomyopathies. But in these individuals, we also need to assess maybe there isn't enough of the nutrients that help to vasodilate the arteries, and there's too much too much
Constriction.
tension that's causing the elevation as well. We see in research, especially like some people who are heavy lifters or who are doing a lot of exercise, they kind of push at the gym, and that
Mm.
causes elevations of 400 over 200 because of they're not breathing properly and they don't have that breath work alignment.
Right.
So while the doctor is trying to look for a cause, the cause is not usually found in conventional models because they're not looking at inflammation and insulin resistance because those don't have medical treatments. They're a lifestyle and nutrition treatment, and they're not well versed in it. So
Yeah.
a lot of times we're like, well, the doctor said there's nothing, I just need to take this medication. Well, from a medical standpoint, there's truth to that. But from a preventative arm, that's usually not really comprehensively assessed.
Let's talk about triglycerides and cholesterol. I think I mentioned this last time we had a conversation that I have come to understand that women in menopause often get a bump in their cholesterol. They see it rise a little bit, myself included, with a little bit higher triglycerides, which freaked me out. I feel like I eat healthy. Mind you, I feel like I do eat a lot of nuts and peanut butter. That is like a go-to every day. And I know last time we talked about saturated fats being something that we want to be mindful of. So, can we talk a little bit more about triglycerides, how to eat in order to help lower that number?
Yeah. So triglycerides are a type of fat that's in the blood. And many times it can rise again from several different factors. So there are individuals who have a genetic component, but this is when someone has triglycerides above 500 since they were younger. So that's usually, it's something called familial hypertriglyceridemia. And in those individuals, it's again a saturated fat issue that we need to be monitoring because they don't know how to digest those properly. Um, in other individuals, triglycerides rise because of insulin resistance. So if someone has fatty liver disease, if someone has elevated glucose levels or elevated insulin levels, that's more of a insulin resistance component to why
Sure.
triglycerides are elevated. Essentially, what happens is if your body doesn't know how to properly put the foods that you're eating into the cell, it's going to form a into triglycerides, which get increased in your blood vessel, in your bloodstream, in your blood vessels. And why is it dangerous? Is because high triglycerides actually make our blood stickier and more susceptible to clotting. And
Hmm.
so we want to make sure that we are reducing them and paying attention to triglycerides to prevent strokes, atherosclerosis, AFib, a lot of heart related conditions. Now, how do we do that? So, there are many different strategies. One is we have to evaluate the balance of your meals. That's one. But really looking to see, okay, is there any refined sugar in there? We know that elevates triglycerides. We know high saturated fat elevates triglycerides. We also know an excess metabolic load increases triglycerides. So some individuals who maybe are fasting and only eat one meal, but that one meal that they're eating is a lot of food to sustain them, that's a lot on the system. It doesn't know how to process it. So your body tries to digest it. And even though you're eating one meal, it struggles. So that if it doesn't go into the cell, it's going to go into the bloodstream. So your cadence of how much you're eating and what you're eating has a big impact on here too. Now, in terms of one more additional component from a nutrition perspective is high triglycerides can be benefit in terms of reduction by including more omega-3 fatty acids, primarily EPA and DHA to help lower it as well. So depending on the dose, that may be something to consider, especially if you're not eating at least 3 servings of fatty fish. A supplement may be helpful in these situations too.
Yeah. Okay. That's great. Um, you just mentioned fasting there quickly, so I wouldn't mind asking you about your thoughts on that. I've a little bit changed my tune on that as a protocol, although I still think for a lot of people, if they want to do intermittent fasting or time restricted eating, where they are eating in a specific eating window, then that can aid in reducing body fat percentage or losing weight. But where I've changed my tune is that part of what we want to do as we're aging, because we're facing the threat of sarcopenia, the loss of lean muscle, we want to make sure that we are increasing lean muscle tissue. And that is an anabolic phase, right? We need to have a lot of good, adequate amounts of protein, complex carbohydrates, healthy fats in order to fuel workouts, in order to build muscle. And so what I tell people now is if one of your targets is to increase lean muscle tissue, then you have to be in that anabolic phase periodically throughout the day. And oftentimes when we choose an intermittent fasting window, especially if it's less than 8 hours of eating in a day, you won't have enough time in that eating window to get your adequate amount of protein in. And so extending the window, which is sort of maybe where the time restricted eating comes in, you're still controlling the amount of time that you're eating, but you're extending it. So it's maybe like 10 hours in a day, leaving at least 3 hours before bedtime so that your body's not in that digest and transport and metabolism state while you go to bed. But so that's what I'm sort of thinking right now, that I think it's not for everyone. If you want to build, which I think all of us should be wanting to do, having a small eating window, like a 4-hour window, is not ideal for that. So thoughts on fasting?
So, like you just mentioned, it's all about the details. You cannot get your nutrients for heart health and functional aging in 4 hours. You are putting stress on your body to eat during those 4 hours, and you're ruining your metabolism because you're teaching your body, hey, only eat in this 4 hour window. So it holds on to reserves in the other windows. With that being said, I do not want someone to be eating every hour and pumping insulin and kind
Right.
of, causing more metabolic issues and asking our body to overwork. The window of time of eating in the research, especially for cardiovascular well-being, is about 10 to 12 hour window
Yeah.
of time. But there's a detail that's also important here. I don't want people to, no matter what they're eating, kind of have a huge dinner and starve for lunch because they're busy. And, a lot of times we're in this fast-paced environment where you kind of say, oh, I'm not going to eat until 12 because I'll be able to hold my calories, I'll have less calories. And then the second you eat at 12, you're starving. So you overeat, you're never satisfied, you're grazing. I'm really about ensuring you're getting good meal timing to help with insulin sensitivity. We are more insulin sensitive in the morning. We digest food better in the morning. We should be eating within an hour of waking up and consistently fueling our bodies every 3 to 4 hours so that our body has time to digest, put in the cell where it belongs. Hunger signal shows up, we answer it for optimal metabolic rate, but again, to get those nutrients that you need. And then we should have, like you said, a pause 2 to 3 hours before bed where we're nighttime, we are insulin resistant. We are terrible at digesting food at night. And a lot of times in the morning, we're like, okay, I'm going to be in a caloric restriction. I'm going to lose weight. So we don't eat in the morning and then we put all of our calories in the evening. So I want to shift, like intermittent fasting of having some rest period is great for our bodies. We shouldn't be eating all day. We shouldn't be eating all night, but really shifting it to early in the morning so that we're helping our body with the metabolism of food for optimal metabolic health is essential. So maybe your hour of window is like 6 a.m. to 6 p.m., or maybe it's 6 a.m. 7 p.m. 7 a.m. to 6 p.m. That is more conducive to optimal metabolic health.
Yeah. Yeah, I agree with that. And I heard I, I can't remember who it was, but I just was listening to a podcast too that was talking about muscle protein synthesis can occur in your sleeping hours if there is an evening protein forward meal, like right before bed, something protein, which back in the fitness days, that's what we would recommend, that everyone have a casein shake, because casein was slow digesting, and it would, it would fuel it, go into your muscles while you're doing this sleeping and repair. And um, now, so I just heard that, and by a reputable doctor researcher as well. So, but then I put that advice up to the menopausal woman who definitely doesn't, like you said, want all of that food multiple times throughout the day, where it could spike insulin, right? And if the energy is not being used up vis-a-vis our exercise, then that can just get stored as fat. Estrogen is dropping. We just don't have this capacity as well to use all of the fuel. So we should be eating less. But yeah, what are your thoughts on that? That late evening protein for increased muscle protein synthesis in a menopausal woman.
So I think this comes back to the fact that people want rules of what to do for
Oh,
what.
don't we? Don't we ever? Yeah.
And it takes away the fact that we be in tune with our own body. If
Yeah.
someone is not hungry and now they're eating a casein shake before bed because it's going to help them with building long-term muscle, you're adding in, or you're adding things your body is not asking for. If you wanted to incorporate that in the last meal of your day, and it was when you're hungry and it fits into your schedule, no problem. But if you have protein adequacy throughout the day and your body is absorbing it alongside strength training and exercise, like you speak about very well, I think we don't necessarily need to just be shoving it this time of day just because. And I think this is really important going into the beginning segment of this podcast of 2025 should not be a place where, oh, I saw this, I don't know, colostrum supplement being pushed. And, I should be having that because this celebrity told me to. It's like, well, wait a second. What are you inputting in your body? And we have disconnected that in our society. And it's really important for us to take a step back and be like, I'm not hungry. I
Yeah.
just had a good, well-balanced dinner. I'm not going to have just a casein shake to have it because that's not going to work in your body. It's not what you need. And I think right now we're in this very protein phase where people are having exorbitant amounts of protein that's not really the issue when we're talking about women in menopause. We need to be looking at all of the other nutrients that actually are needed and needed in more volume than before the menopausal period of time. And yes, protein requirements do go up. I'm not saying it doesn't, but most people right now, especially with this new hype on protein, are not protein deficient, are not getting too little protein. They're not getting maybe enough magnesium, potassium, folate, all the
Right.
other things that they need because now we're hyper focusing on one macronutrient.
I love that you mentioned that. I had Dr. Stuart Phillips on the podcast, and he's a protein researcher. And when I asked him about an adequate amount for muscle building, and he did mention as well that yes, we need an elevated amount as we age. But he said the lower end of the recommended amount is still fine, is still good. So he says anywhere between that 1.6 and 2.2 grams of protein per kilogram of body weight, or zero point 0.8 to 1.2 grams per pound. So for my body, my size, that's anywhere between 96 and 126 grams a day. And so I said, so the 96 is good, like 3 meals of 30 grams. He's like, perfect, excellent. So you're right. We are very protein crazy right now, aren't we? Everyone's like, how much protein? And it's good because I think previous to that, people thought they were getting adequate amounts of protein. But, when you tallied it up, they were having cereal for breakfast and maybe a sandwich for lunch with one thin slice of ham, and then maybe something with adequate protein at dinner. But the tally was like 40 grams for the day. So it's good that we're thinking about it, but I agree that yeah, and like Dr. Stewart said, you can get that lower end of the target is okay too.
Yeah. Yeah, it also is protein's very satiating. So when we often just think of that, we don't have room for other things in the diet too.
Right.
And I think now a lot of people are looking at like 2 grams per body weight, and that is just too much. Remember, your body has to also break this down. And so the excess puts pressure on your kidneys, puts pressure on your liver. We need to be thinking about all of our organs and the whole body so that when we look at functional aging, yes, we're strong, we have enough muscle mass, but we also have the other nutrients that improve cognitive health and heart health and vascular health and kidney health and liver health because they all matter when we're thinking about functional aging. So we need to be looking at the whole picture as often as that doesn't look as sexy as kind of looking at just one nutrient.
Yeah, I love that you highlight that because you're right, that is just so important. When we think about emotional eating, how does emotional eating impact women's heart health? Um, yeah, what do you have to say about emotional eating?
Yeah. So I think we need to realize that you can't just tell every single person, hey, eat this. This is exactly what you need to eat. It doesn't work. Our nutrition, what we choose, is culturally embedded, it's emotionally embedded. It's always there. You go to a holiday celebration, you go to a sad whatever is happening, every event, there's food
Food.
around.
Yeah.
And it's driven a lot with our childhood, with, our food preferences, our texture preferences, our emotional well-being, our comfort. And we need to acknowledge that in the picture of when we're talking about a lifestyle plan and making sure that this lasts long term. I think a lot of times, identifying, what? I was really stressed and I went to get cookies. And first identifying that that's there is an important component to
Yeah.
then working through it. So it's very prevalent, and we shouldn't ignore it. And I hate when people say, oh, it's willpower. This isn't willpower. A lot of times we crave chocolate at night or we crave something after dinner because we didn't properly fuel ourselves earlier in the day. And we say, oh, I have a sweet tooth. I can't get rid of this sweet tooth. I'm always craving sweet tooth. Well, there's probably a reason why. And so we need to unravel that so that we can, for the most part, be able to then come in with an action plan that works for you, that addresses that challenge that you're facing. So a lot of that is important for discussion and important for us to be open about it in that communication so we can help with it. Because if we just say, no, I'm going on this diet, this is what I'm doing, and we ignore our desires and our wants, that
Yeah.
diet lasts until January 31st,
Yeah.
February 1, it's over.
That's it.
I want, right. I want to get rid of that fad diet mentality and really look at this as this is a journey, this is a lifestyle. And we need to take into account all the emotional components of these because there's a lot of that that's part of your dietary choices too.
Yeah. How do you shift someone from that diet mentality that, they have a target, they have a goal, they've got their son's wedding, they've got the cruise, they've got their 50th birthday, and they just want to lose weight for that occasion. I see this in fitness all of the time as well. And we have a saying at Move Daily Fitness that I actually stole from Seth Godin, who's a marketing specialist. But he said, people like us do things like this. And that's been my catchphrase. This is what I want to teach people is that people like us do things like this independent of the context. So independent of the fact that it's holiday season, we still move daily. We still incorporate lots of healthy vegetables and micronutrients in our diet. We still prioritize protein and fiber. We still go to sleep and wake up at the same time or relatively the same time, right? We still practice mindfulness. We still attend to our needs. And yet, I just find so many women are on and off and on and off. And for me, as someone who helps them, it makes me sad. And I just want them so bad to make this a lifestyle, to make this consistent, because I know the benefit it's given me. So, how do you coach someone to shift from this diet mentality to, like starting January 21st or January 1st to making this a whole lifestyle change?
So I'm gonna deviate for 1 second, but I promise I bring it right back because when you're in
Okay.
the middle of talking to all of this, it just reminded me of one of my clients. And he goes and he said to me in one of our last sessions together, he's like, Michelle, you actually taught me how to live a lifestyle. I was on a diet my whole entire life.
Yeah.
Never until I met you did I realize that this is my life. And so the perspective that, and I specialize in cardiovascular disease. So while some people come to me with one of their goals is weight loss and specifically abdominal weight loss, that
Yeah.
visceral fat, a lot of my clients have high blood pressure, high cholesterol, or they have cardiomyopathy or heart failure. They have a heart-related diagnosis. So it might be a little bit different because their perspective is more of, I want to live a long life. So this client specifically came to me because he was looking to retire and he went and did a calcium score and it was very high. And he's like, I want to make sure that I'm doing everything I can to go into my retirement with a happy and healthy and being able to travel with my wife and my kids and do everything I want without having a heart attack. So his focus was really on optimizing all of his cardiometabolic metrics. He lost weight, he lost inches off of his abdominal weight. He's like, Michelle, this is so easy because I'm following my blood pressure. I'm seeing all of my cholesterol numbers be optimized. I'm seeing my blood sugar be normal, and I've never really seen these numbers in my life. So he's like, I'm validated that what I'm doing is not just an appearance thing, right? When I was going
Mm.
on a diet, I was like, oh, I want to look good. Like, I don't want this belly. I don't want this. But now it's different. He's like, I want to live my life. He's like, I have more energy. I wake up and I'm ready to go. He's like, I work out and I have energy afterwards. I used to be sluggish. I used to want to take a nap at 3 p.m. So a lot of these benefits come from the mindfulness of realizing when you properly fuel your body, when you honor and address cardiometabolic health, your body thrives because you give it the nutrients it needs. It goes into the cell it needs to go into. It gives you the energy and the stamina, but it also improves your cardiometabolic metrics that we have to be monitoring. So, a lot of the continual lifelong process is you put in effort. And you need to make sure that that effort shows up in what you're trying to achieve. So he would check blood pressure every day. That was coming down really nicely, was optimized, continues to stay optimized. He's checking his waist circumference. He's seeing those benefits, right? So when we're looking at weight loss, because I know that's a hot topic going into the new year, I really recommend that most people, instead of looking at a number on the scale, check your waist circumference. It's your belly button. Check that waist circumference. If it's above 35 inches in a woman, above 40 inches in a man, and in certain ethnicities, that's 2 inches less, we need to intervene that. I've seen people lose 6 inches off of their waist before 1 pound comes off on that scale.
Mm.
And why is that important? Because
Mhm.
it's telling me there's inflammation, there's insulin resistance, and those things need to be addressed from a health perspective. And once those are addressed, then weight loss is much easier. But if you're only looking at that number on the scale, you're not seeing the full picture of your health. And so when you take that perspective of why are we doing this? What is it showing up? That encourages more individuals to look at the full picture instead of only focusing on caloric restriction.
Yeah, and I loved a few things that you said there. I like that sort of regular check-in. I know some people don't like stepping on the scale. It can be an emotional trigger for some people. I like the short accounts with myself in lots of ways to measure my progress. So I think for some people, the scale it's either for you or it's not. But the blood pressure and the waist circumference, those are great things to track and see your progress on that, because it tells so much of the story. Secondly, I loved how you are making this shift from the external really to the internal, right? So I think in our younger years, that really does drive us. Like, so what do we look like? How do we look in a bathing suit? What are people going to say about what we look like? And one of the things that kind of bugs me when people lose weight, someone will say to them, "Oh, you look so good. You look so good." And it really drives home the fact that when I'm, my external, what I look like is my value. And not to say that it's not important to carry a healthy body fat percentage. I think that. But do you know what I mean? It's like when people say, "Oh, you look so good because you've lost weight." And it just drives this mentality that that's what I'm going for. As opposed to, and this is what we're trying to do at Move Daily Fitness as well, is what's happening on the inside. Let's go for longevity. Let's go for strength. Let's go for heart health. Let's go for brain health. Let's go for energy. Like these things are going to carry us through to our retirement and beyond in a good way. So yeah, I love that.
And
Love
I'm
it.
going to just piggyback that comment one more time. Heart disease happens in any body shape. People go to me, how did I have a heart attack? I'm not overweight. I
Right.
go, we don't see your arteries when we look at you. I've had athletes have cardiovascular disease. For instance, look at like Bob Harper. He had a
Yeah.
heart attack.
Yeah.
People will say, oh, well, that was genetic because, he looked great, whatever. But genetics alone does not cause heart disease, like I mentioned in your
Yeah.
last
Yeah.
podcast.
Love that. Yeah.
And so we have to be looking at, heart disease. You don't feel high cholesterol. You don't really feel borderline high blood pressure that causes the plaque to progress in the arteries. You don't feel these things, but they're brewing silently. And so we need to be more proactive in testing these parameters. I have many people who I tell everybody, even if their BMI is normal, please check your waist circumference and let me know what it is before working with me. And most people are shocked. They're like, but I wear like a 32 pant size. How is my waist like
Mm.
37? I'm like, because you don't know unless you measure it. And the other point is okay, if your waist circumference generally is 33 inches and it's normal, awesome. I want you checking it every 6 months. I want you checking it every year. When you go to the doctor's office for your physical, you check your waist circumference. If it moves up by half an inch. Hey, what's going on? Things are brewing in the wrong direction. Again, you need to know your baseline. I work with so many doctors, and many internists have referred clients to me. Out of, let's say, 50, one is the only one who's checked waist circumference in any of his clients. And he said if it goes up by a quarter of an inch, we need to intervene.
Mm.
And that's being preventative. We are in a very medical, treatment-based model, right? You have an issue that's
Yeah.
there's a problem, let's treat it with medicine. We have a prevention area where we can prevent that from happening, but we have to be alarmed of what our numbers are, what our baseline is, monitor our trends year to year, and if they're going in the wrong direction, intervene before it becomes an issue.
As JFK says, the time to fix the roof is when the sun is shining. Yes, love it. That's such great advice. Okay, we're going to finish off with a little rapid fire Q&A here, okay? So I didn't tell you about this, but it's going to be fun, I hope. So, just let me know what your answer is. First thing at the top of your head, some might be a little bit longer. But let's talk about this. What is your favorite heart healthy holiday treat?
My favorite heart healthy holiday treat. I'm trying to think of a holiday treat. I don't know. So I'm Jewish. I like my latkes. I would look that as a treat, but like I like it with like some Greek yogurt on top, maybe like some like a homemade cranberry sauce. Like that's kind of like my jam if I had to be like, what am I looking forward in the holiday season? I'm not a baker. I don't know how to bake. I know how to cook really well because I experiment with recipes, but I can't measure anything. I have a cookbook and I can't even follow a recipe in my own cookbook. But I do like baking with my kids. So we will try different recipes. And right now I've been doing these like delicious oat bran muffins with lots of berries inside, and those are really good too.
What's the best spice for heart health?
That's a really good question. If I had to give you, I'm going to give you one sweet and one savory. Well, I guess this is more savory. So ground cloves are one of the highest anti-inflammatory spice there is.
Yeah.
Ginger, turmeric, black pepper, garlic. I mean, there's so many great spices. Use the ones you like. Enjoy them, flavor up the food, but realize they're really, really potent antioxidant benefit.
One food that you think is underrated for heart health.
I think soy. I think soy gets a bad rep. And I would say that that's only the only food that contains isoflavones that help to increase S equal in the gut that helps to reduce arterial stiffness. So I like that one, and I think that one gets a bad rep.
What's one ingredient swap you love making?
I'm not really a big mayo person, but I like Greek yogurt, so I will use that a lot in my swaps.
Favorite way to add more fiber?
Always, but I would say adding in more green leafy vegetables is always a good boost.
If you could recommend one nutrient to focus on for women's heart health, what would it be? I know you're going to say there's not just one, but what's one that maybe we're not getting enough of?
Calcium.
How do we add that in?
So it depends on which foods you eat or don't eat. I think a lot of people are in the restrictive mindset. So if you're not eating dairy, you need to make sure that you're planning in more of that in your day because we need it for optimal bone health, but also optimal heart health. If you don't have enough adequate calcium intake in your diet, your parathyroid hormone will signal your bones to release calcium, and that can cause osteopenia, osteoporosis, and vascular calcification because now you have unused calcium in your vascular system that can contribute to the plaque formation process. So calcium is important and primarily through food because if you take it in a supplement form at high dosages, that can also lead to more vascular calcification because there's unused calcium in the blood vessels.
Daily yogurt and some broccoli. Would that be a good?
That gives you maybe close to like 400 milligrams. We need women around 1200 milligrams, so it needs to be more intentional. It's found in sardines with bones, collard greens, kale, broccoli, chia seeds, and making sure you're getting the adequate amounts.
Okay. And finally, what's one small habit women can start now for better heart health in the new year?
Check your blood pressure.
There it is. I knew you were going to say that. I think that's such a good tip because I think the lion's share of people don't do that. And right now, I should buy shares in that company that sells the blood pressure cuffs after this podcast. No. Yeah, that is great. And I'm going to do it more regularly. Mine's actually out on my table right now. And so just leave it out there. Just do a daily check. My dad, who actually had a heart attack, a minor heart attack, but had a stent put in. He checks his every day. He's got a little journal. He writes down his numbers. Very cute. But he's 85 and it's good. It's good for him because it keeps short accounts, right? And you're right. Like if you notice something different for you, then that's where let the alarm bells go and have a visit with your physician and have the conversation. Because it's time to fix the roof is when the sun is shining. So, yes. Michelle, thank you. You are a wealth of information, and I've enjoyed having this conversation again. Have a great holiday season, and you are welcome back anytime because this is going to be a definite topic of conversation for 2025 for myself. I want to improve my heart health. Folks, I hope that you do as well.
Thank you for having me. This was lovely.
Absolutely. And now everyone go move daily in your fitness, wellness, and nutrition. And we'll see you all on the next Move Daily Talks.